Good morning. This is Module 4 assignment in which we were to watch the YouTube video and provide a summary of the video. I watched the Minute Clinic Connect where telemedicine was shown in action with John, the patient, in which the nurse practitioner was able to view John on a telemonitor with a nurse present in the room with him and was able to review his vital signs, notice his temperature was increased, was able to have the nurse perform an exam while the nurse practitioner was able to view it through the telemonitor, and she was able to see through his the testing of his ears and his throat that possibly he had strep throat. And while they were still communicating via the telemonitor, she was able to get the strep throat test results back and make a diagnosis and come up with a treatment plan. There are a couple differences between telemedicine and telehealth, which I believe in the video it was called telehealth and telemedicine. Telemedicine is remote clinical practice, which we saw in the video where a patient was treated and diagnosed by a medical professional via telecommunication, whereas telehealth is more provider training and professional education that's provided through either the internet or WebExes or some other type of technology. There's a few different types of telemedicine. Patient portals where secure messages are sent to providers. There's obviously over the phone, that's been quite common and easy to use. And then there's the audio video, which we saw through the Minute Clinic Connect link, in which you can hear and see the patient and are able to come up with a diagnosis. The reason for the big push for telemedicine, there's a few reasons for that, and there's a high number of baby boomers that are getting older and have chronic diseases. There is an increase. It also increases patient satisfaction. They have that one-on-one time with their provider and are able to ask questions that they may not have time for in a clinic visit. It's also great for homebound patients that it's difficult for them to get out of the house and go to appointments as well. So those are definitely some positives. It is quite expensive to have this type of technology, but that is one of the goals for the future of healthcare, is to work on minimizing those costs. I was fortunate enough to see this week at my job, we're actually doing a pilot for telemedicine with a specific patient group, and I was able to see it in action, in which I could see the patient in his home with the nurse present and also the physician in her office, and see the communication back and forth and how the physician was able to look at the gentleman's hand and see how he was progressing with his illness, and had the nurse there in the home to do any further recommendations that she had for the patient. So that was really nice to be able to view that. So I've been able to see it in action. And I believe that is about it. Thank you.